you. Good afternoon, everyone. Let me start by warmly welcoming everyone here on behalf of Her Excellency Lina Al Hadid, Ambassador of the Hashemite Kingdom of Jordan, to join our side event on cannabis new prevention policies between myths and facts with all of you, our dear colleagues and partners. First of all, I would like to thank UNODC for their support in preparation of this event on such an important topic. Ladies and gentlemen, policies regarding cannabis have been changing and evolving for the past 30 years. But as the movement of legalization continues to expand, we have to make sure that we know how cannabis use impacts physical and psychological health of vulnerable ones, in particular youth. Many observational studies have suggested that adolescent cannabis use may be linked to long-term harms. Further, the majority of data support poor cognitive performance on measures of attention and learning and memory in adolescent users of cannabis. I would like to reiterate an important point. Jordan remains a strong supporter of the international drug control system, as established by the 3 conventions. And we are committed to finding solutions that promote health and safety of Jordanians, while maintaining the international drug control framework as the foundation for international collaboration on drug policy. We support the work of the CND with our international partners, sharing expertise on approaches to mitigate the harm of problematic substance use and supporting capacity building as well as developing policies to prevent the abuse of cannabis. Recently, the Parliament of Jordan passed an amendment to the Narcotic Drugs and Psychotropic Substances Law, which includes that the abuse of these substances will no longer be entered into the criminal records of offenders if it's their first time. Dr. Musa Dawood from Jordan Anti-Drug Society will further elaborate on this topic. Dr. Dawood, the floor is yours. Thank you very much.
Thank you, Your Excellency. It really was a pleasure to having you in this unexpected circumstances. So thank you so much. We appreciate all your efforts. So please, I would like to pass my regards and to my colleagues in the Jordan Anti-Drug Society, to you and to the embassy staff from the Her Excellency Ambassador Lina Al Hadid, to you, to all of our people there in Vienna and in Europe as well. So thank you so much. I would like to thank also everybody who joining this virtual side events at the 65th session of the Commission on Narcotic Drugs. My name is Musa Dawood. I work in the Jordan Anti-Drug Society, which is organizing this event with a special support of government of Jordan and co-organized by the World Federation Against Drugs, Utrip institution, and Turkish Green Crescent, with all of our appreciation. Now, I would like to inform you that this side event is being recorded. I'm also, please feel free to pose any question or remarks using the question and answer section instead of the chat. And we will try to answer them at the end of the presentations, depending on the time left. Distinguished delegates, ladies and gentlemen, please allow me now to introduce our first speaker, Mr. Eric Lejean-Marc. Eric, are you here?
Yes, I'm here. Thank you.
Yeah, Eric from the World Federation Against the Drug. He is a professional with over 10 years expertise in the issue of organized crime and illicit drugs. He's also author of a parenting handbook on drugs, and he has many appearances in the media and debates on various topics related to drugs. Previously, he was the Secretary General of European Cities Action Network of Drug-Free Societies, ECAD, and research fellow at the Institute of Security and Development Policy in Stockholm, focusing on studies on organized crime and drug trafficking. Eric, the floor is yours.
Thank you, Dr. Musa. I will try now to share my screen with you. I hope that it will work out well. I'd like to talk a little bit about, thank you very much, about a subject that I know very well. And also you mentioned I wrote a parenting handbook, and that is also one part of that was to find out what happened or originated on the island of Iceland, which has a very interesting example for the rest of the world to follow when it comes to prevention policies. It's, I mean, on cannabis for sure, but also a more holistic approach to prevention policies. So I'd like to share some experiences, which is very well known to me, how that was made possible. So basically, just before starting, I would like to say that it's of course a very important topic overall, generally, to focus on reducing the use of harmful substances and risky behavior as well. And prevention makes very much sense when it comes to mind that many deaths worldwide scale could be attributed to risky behavior and non-communicable diseases, of which substance use contributes quite a large part. So there is a lot to win from successfully engaging in prevention, but it also needs to be done in a coherent and smart way. Just because the purpose is good, it doesn't mean that anything we do will also be good. We need to really apply science to it to make it effective. And this is what I'd like to talk about, and also share some of the negative experiences that the Icelandic example kind of moved away from, just as an example to follow. Let's see if I can also, there. I hope you are seeing now. There's a down-turning slide of this substance use from the originating part in the year of 1998 when it comes to adolescents drinking, smoking, and trying hashes. And you can see that the down term is very impressive, so to speak. You could almost say that that island has almost completely evaporated adolescents' use of cannabis. Endemic proportions, smoking was quite high among teenagers in Iceland, and also hashish was at quite high proportions. So really there was many bad things happening, and also even worse than that, everything was going in the wrong direction. And a lot of activities were being implemented in Iceland, and with attitudes of young people to make them having negative attitudes towards substance use by scaring them, for example, into refraining from negative decisions. But as you saw, that didn't produce very good results, unfortunately, by pictures like this, scaring from lung cancer and different bad outcomes. So what they started doing instead was to investigate the causes behind substance use on Iceland for the teenagers. And they did that by asking them different, let's say, parameters in their lives. So they went to schools and they did very comprehensive surveys on the lives of young children. And at that time, they already knew that there were certain circumstances and behaviors that were strongly connected with substance use. So based from those surveys, they tried to establish certain risk and protective factors leading on to substance use. So one way of looking at it up until that point had been to look for quite a shallow cause of substance use. And common explanations could therefore be lack of purpose in life, boredom, depression, low school engagement, and so forth. But what they started doing was investigating. And for example, one would be peers, of course. We know that young people who are drinking, almost all of them, or a big majority of them, also have drinking peers. So drinking is a social pattern, of course. That was one of such finding. Another was a strong negative relationship established between spending a lot of time with your parents and drinking. So the more time you spent, the less you drank, for example. That was very clear. And participation in sports among girls on Iceland was that the more you did sports, the less you were doing drugs, basically. So these were some of the findings that were found out. It is very difficult to break that. It's possible, of course, but it's more difficult than trying to prevent these patterns from forming in the first place. So this is what they were trying to do. And they mapped the main risk and protective factors. And for the Icelandic case, they found 4 local clusters of factors establishing risk and protective. And those were the family, the peers, the general well-being of the adolescents, and also what they were doing on their free time. And digging a little bit deeper into these factors, you could see that for the family, for example, it mattered how much time you spent with your parents and what kind of support and control and monitoring parents had over their kids. For the peers, it mattered a lot whether you hang out with drug-using peers or not, for example, and how the parents engaged with the friends of their children, for example, and how late people were staying out, for example. It also mattered general feeling of well-being, bullying, how you were performing in school, for example, and also how engaged young children were during their free time. So these were the main risk and protective factors that they were trying to establish. And then these findings were in theoretical part, at least, it's part of community building. You actually need to change across very many levels in the local community how the local risk and protective factors are shaped and distributed. And this is not done in a short term. This requires a lot of time, and you cannot expect quick result. You need to be persistent, and you need to work on this with a long mind-term setting. You need to address very many levels in society. This cannot be done by a single agency. This cannot be prescriptive from the top down. It needs to be addressed across many levels in society, and especially local society. And you need to have an effective collaboration so that no one feels left out from this. I'm going to try to very briefly show what I mean by that a bit later. And the 3 pillars of success behind the model is that the data, the surveys on the risk and protective factors, they were all the time being fed into various levels in the community and created really a conversation between, let's say, parents, schools, the young people, social workers, politicians, local business community, and others. So this was not a scientific ivory tower project. This was really a grassroots level, and at every level it's always collaboration. And very practical data collections were being conducted continuously with young children, for example. It was followed up regularly to see how the outcome was, and fed back into every school, every parent, and prevention worker. So the findings were used in various ways to shape the local communities. And some examples of this is that, just a handful of examples, that parent organizations were strengthened and parent cooperation was intensified. NGOs, that is civil society, was strengthened. Activities aimed at strengthening young peoples at risk inside schools were being conducted, and leisure time and free time was organized so that there was a lot of extracurricular activities available for young people, so they would not be hanging about doing nothing, just to be very clear. And also at the national governmental level, there were also age limits were raised on buying tobacco and alcohol, which of course are legal in Iceland. The age of adulthood were risen. There were stricter advertising bans on tobacco and alcohol. There was guidelines on outside time for adolescents, and also a visibility ban for marketing purposes on tobacco and alcohol. Some examples you can see here. Before, tobacco were sold always together with chewing gum in local stores. This is no longer the case. Same goes with peanuts and gin, which were sold physically together in stores, and it's no longer allowed. So what were the results on these local risk and protective factors? Well, in short, the preventive factors were strengthened and the risk factors were weakened. And for example, within family, Icelandic youth now spend more time with their parents. The parents have better support capabilities. They know much more of the whereabouts of their young children, and parents speak much more to each other, also about each other's children. And parents and children spend much more time together, as you can see in the graph. My parents know where I am in evenings apply to it's a big majority of Icelandic youth today than was before. kids are spending less time late outside, and peer groups are better organized so that parents know the friends. I will be very quickly finished. And school engagement are being better, less bullying, and leisure time is organized so that everyone knows much more what to do and not being unorganized, as you can see here. So this has been the outcome of strengthening those local risk and protective factors. And I think this is very important to recognize that it can be done through creating a supportive environment through the use of practical applied data. So this is the last slide. I'm just going to make a short comparison between how the Icelandic approach might differ from some of the other approaches sometimes being advocated for in prevention. The Icelandic approach is very long-term, it's very collaborative, and it's focused on holistic change on the whole environment in which young children are being brought up. It's also community-driven and very service-intensive, as opposed to being research-intensive. And it fosters sustained and long-term benefits, not only to some, but also to various community partners. So I think this might be, this local perspective, this data-driven practical approach could be something that we need and can hopefully inspire change across the world. So with this, I'm going to finish, and I'm happy to take questions afterwards also.
Marvelous. Marvelous. Thanks a lot, Eric. Your input is great, and it added a value to our events. And you know, the Iceland model and approach is very interesting model, actually. And we need to go through the details of such models. It might be used in different countries and in different places in the globe. Thanks a lot again. Thanks for sharing this kind of example. Thank you. Ladies and gentlemen, distinguished delegates, our second speaker is my friend Matai Kosher, Director of Utrip since 2006. He has been working in the field of addiction prevention and alcohol, tobacco, and other drugs, ATOD, related policies for the last 23 years. He is an author, co-author, and reviewer of scientific articles and papers, and external evaluator of the EC-founded projects in the field of health and research. He is a lecturer and facilitator of training and workshops in the field of prevention and advocacy, and his CV has a lot to say more. Matai, the floor is yours.
Thank you very much, and thank you for inviting me to be part of this side event. We have been together in Vienna in the last few days, but I'm now at home, so safely came to my home yesterday in the evening. So I'm presenting from my office. Let's start with my presentation, not to spend too much time for introduction. I will mostly speak from prevention science perspectives regarding cannabis policy or also cannabis consumption. So just to make a context, to set the scene, it's good to present some data, and I have most relatively recent data from Slovenia. And we know in my country that the situation is getting worse regarding the use of cannabis, especially among young people, and related problems, such as prevalence, intoxication, poisoning. And I have to mention in this context that legislation legislation remains the same. So nothing changed from the legislation or regulation perspective. So this is just the data I want to explain and to set the scene and produce some context, so you can then understand what I'm going to say in the next slides. And also, if you can see, comparing to some other European countries, Slovenia is above average regarding cannabis use among young people. So you can see that about 1/4 of our young people age 15, 16 already consumed cannabis in their lives. And also regarding some other statistics, for example, lifetime prevalence is going up, and also hospitalizations as a consequence of cannabis use is also number of hospitalizations is going up. So you can see clearly that the situation is not very nice in Slovenia. Is getting worse and worse. But comparing to some global trends, I would say that it's the case also in some other countries. So Slovenia is not some special case, especially not in the Western Europe or Western Hemisphere. For example, comparing also to United States or Canada, where cannabis is more available and regulated in another way. So we see also the trends in perception of risks related to cannabis use among young people, and these perception rates are decreasing. So young people don't think there are some important risks by taking or using cannabis. And also perception of harmful effects and consequences related to cannabis use among young people is also decreasing. So the negative trends are quite visible. Also, perception of accessibility of cannabis among young people is increasing. So more young people think that it's easy to access cannabis, no matter of if it's legal or illegal. So it's pretty much similar. For example, in Slovenia, cannabis is not legal, but you know, the perception of accessibility among young people is extremely high. If we compare it, with the fact that it's not legalized, and also there is quite important trend also, especially among legalization groups, that they very often abuse medical and industrial potential of cannabis towards legalization for personal use and supply. So when advocating for legalization of personal use or personal supply or possession of cannabis for personal use, they very often include in those discussions also medicinal or industrial potential of cannabis, and try to present cannabis as completely harmless plant or a substance. So this is also a quite important trend which we have to mention in this context. We also have a lot of evidence from prevention science, and this is very classic and basic etiology model, which shows how many different things influence our beliefs, attitudes, and behaviors. It's not just, you know, information. Also, we adults, we know a lot about the unhealthy food and drinks, etc., but we still behave in a, you know, in a risky way. We still consume alcohol. We still eat unhealthy food. We still break traffic rules, etc. So even although we are informed well about the potential consequences and risks, we still behave in a risky way. So it is even more problematic among young people, among adolescents in the period of brain development. So there are several other even more important environments or levels which influence our beliefs and attitudes. And I will just present some of the theoretical background in prevention science by Eisen. This is already more than 30 years old. They knew at that time already that there is a link between attitudes and behavior, and that the three sets of perceptions and attitudes guide behavior. For example, beliefs about the outcomes or consequences of the behavior. The second, beliefs about others' normative expectations or social acceptability of the behavior. And the third important set is beliefs about the barriers to an enhancer of the performance of the behavior. So it's pretty clear that for the three decades, we already know pretty much well about this link between attitudes and behavior. And another important issue, which is also related to etiology model, especially with macro environments and with regulation, and including micro environments such as family, or for example, environmental constraints within the families. So those I don't know how to say it, those characteristics or those influences are extremely important in behavior at the end. So if we look at the risk and protective factors, and also already Eric mentioned quite a lot about risk and protective factors. And nowadays in prevention science and also in prevention practice, we are more and more focusing not on each behavior or each substance, but more and more on risk and behavior factors, because we know that the same risk factors and the same protective factors are characteristics for many risk behaviors. So it doesn't matter actually to focus on particular substance or behavior, but it's more important to tackle risk behavior, to prevent, to decrease risk behavior, risk factors, and promote protective factors. So from the community point of view, we see that also laws and norms favorable to drug use are the risk for substance use, and also perceived availability of drugs. I mentioned already this risk before. From the family perspective, favorable parental attitudes to the problem behavior is also an important risk factor. So if parents, for example, don't care about what kids are doing, or if they use alcohol, tobacco, or drugs, probably kids will continue without any barriers or any problems also in the future. And also from the perspective of peer or individual domain, we see that the favorable attitudes towards problem behavior and interaction with friends involved in problem behavior are particular risks for young people. And continuing on risk factors, which could then have impact on cannabis use among young people, we see again from the literature that positive attitudes or positive beliefs towards cannabis or cannabis use are the risk factors. Also, perception of increased availability of cannabis is a risk factor. Poor parental control is additionally important risk factor. Friends using cannabis, social norms that are in favor of using cannabis and presented like this in legislation or media. Also, it's not necessary that in legislation, but also in media, if we discuss about cannabis in media as a harmless substance or harmless plant, there will be a consequence also in prevalence and perceptions, etc. So that we know already from the literature. What could legalization bring? So in many countries, we are now discussing legalization of cannabis, including in our country. I have to say that we were able until now to prevent at least three attempts by politicians to smooth regulation on cannabis. I wouldn't say legalization per se, but some changes of legislation which might open the market for also legalization of cannabis for psychoactive use. So we were able to prevent already three attempts to smooth legalization of cannabis in Slovenia. And we know also from the literature that legalization can bring changed views, and because of that, change attitudes regarding cannabis, such as normalization of third legal drug. And if we compare it with alcohol and tobacco, we know that we are, in most of our societies, we are not able to control alcohol and tobacco sale. Because we know also from research, if I can also give an example from Slovenia, most of minors less than 18 years old can very easily get alcohol and tobacco in our supermarkets, gas stations, or nightclubs. For example, in nightclubs, it's less than 10% compliance rate, which means that vast majority of them can get alcohol very easily in nightlife and bars and pubs. So we would like now to bring the third drug, and we expect that it will be controlled and regulated well, etc. But on the other side of this spectrum, we have already alcohol and tobacco and a lot of problems to control those two legal drugs. Normalization of third drug would definitely bring additional problems, not just for us as citizens, but also for legislators, for policy and decision makers, for those who are responsible to control the implementation of legislation. The second thing which is important, what could legalization bring, is increased accessibility and, of course, use of cannabis. More difficulties for parental control and prevention. This would definitely influence also the possibilities and options for parents to control their kids. And increased use among young people due to peer influence based on the higher perception of use among young people, and weaker social norms regarding cannabis. This would all be a consequence of legalization, and this is happening in those countries which regulate cannabis or which legalized cannabis in a way. So all those topics are already there in those countries, and would happen also in some other countries if they would go in the same direction. About solutions, I would strongly recommend that while speaking about decriminalization, legalization, we have to take into consideration that in most of those cases, big industries are involved in discussions. And it's now already, especially in some US states, they actually commercialize cannabis. It's fully available everywhere, not just as a joint or a cookie, but also as candies, different kind of products. So it's really commercialized, and you have commercials and marketing very extensive in those states. We can learn a lot from negative experience also with previous, not with still actual big alcohol and big tobacco, how they act. And we know they're involved in these processes of cannabis legalization. So probably all they want is profit from the cannabis legalization. And this would bring commercialization of cannabis for sure in our market. So we should be strongly against this kind of processes and directions in the future. Next is strictly separated debate on various aspects of cannabis. I already mentioned that the legalization groups often abuse the medicinal and industrial potential of cannabis. And we should be really strict in our countries to separate those discussions and not to mix apples and pears and watermelons together in one debate. So this should also be our very important focus while advocating against the legalization of cannabis. Also, it is important to emphasize that investment in evidence-based prevention and increased knowledge and skills in prevention workforce would definitely help to prevent a lot of risk behaviors, not just cannabis use, but also other risk behaviors. And also Eric mentioned a lot about the investment in evidence-based policy with presenting Icelandic model with regards to this. And the last, we also have to take into consideration to disinvest from ineffective or harmful approaches, which also don't help us a lot in advocacy efforts against cannabis legalization, because also legalization groups can easily show that prevention doesn't work. So why should cannabis be illegal? So let's make it free, and we'll see what will happen. And they usually say that it will help to decrease the illicit market. They usually say that it will also decrease the consumption among young people, etc. All those arguments are really based on not really on a scientific literature. And the power of advocacy is really extremely important. We know from several countries that we were able to prevent with strong advocacy coalitions at national level. There are also a lot of examples in US recently to stop legalization processes in many US states. And also we have to use the negative experience and data from so-called legal countries because this data exists already after many years of legalization. So we can really use the data from Uruguay, Canada, and USA for advocating against cannabis legalization. And the data includes increased prevalence, increased perception of availability, and also decreased perception of.
Thank you, Matai. Thank you.
This is all from me, and thank you for your attention.
Thanks a lot. I really appreciate because you, as always, brilliant and trying to frame briefly by detailing different perspective on the subject. And Slovenia is a different example than Iceland example. So, you know, showing the distinguish between the policies and long term in Ireland and Iceland, and also having the difference between these kind of policies. It's a very good examples, both of them. And as I mentioned, we at the Jordan Anti-Drug Society rejected the simple dichotomy between the war on drugs on one hand and legalization on the other hand. Instead, we believe in engaging an open dialogue about the strengths and the weaknesses of the global drug policies. And we will advocate as well for the evidence-based strategies to promote the public health, safety, and well-being of society, including those addicted to drugs and their families as well. So thanks a lot, Matai. Our third speaker is Mrs. Zainab from the Turkish Green Crescent, and she will share with us their experiences in the field of prevention and cannabis policies. Zainab, the floor is yours. I know there is not much time, but I will give you the full time for you to talk about the prevention and cannabis policies. The floor is yours, Zainab. Please unmute your mic, Zainab. We couldn't hear you. We still not able to hear you, Zainab. I think Zainab, she has a technical issue. I'll be waiting.
Hello.
Hi, Zainab. Finally,
yes,
I can hear your voice.
Yeah, sorry about the technical problem. Really sorry about that. And thank you for the invitation. So I'll quickly try to share my screen now. Hopefully it works out fine. Yeah, and sorry. Yeah, can you see it properly now in full screen, my presentation?
Perfect.
Okay, great. Thank you very much. So again, thank you for the invitation, and also thank you to all the panelists for their very interesting and valuable insights. I have taken notes myself too of their experiences. So again, hello, my name is Zeynep Temel, and as Dr. Daud also said, I work as advocacy specialist at the Turkish Green Crescent Society. So very briefly today, at this extremely relevant side event. I'm going to very briefly try and talk to you about the most recent numbers first, again, to give you a context about the most recent numbers of global, regional, and national cannabis use, then demonstrate an example of a relevant issue, of course, with policy implications, and then why prevention, especially early prevention, is needed and relevant, and of course, the policy implications as well as the way forward. But first, to very quickly sum up what we as Turkish Green Crescent Society do and our key priority areas. So we're an NGO that's working on tackling different types of addictions, namely alcohol, tobacco, and drugs, as well as the behavioral ones. We conduct prevention, treatment and rehabilitation, and advocacy work in our struggle against addictions. And our core principles are to be based on evidence and science and to have a global vision. Now, this is important because, as I said, we're going to look at global, regional, and national evidence shortly and see what cannabis decriminalization or legalization really means, particularly for youth. So as we all know, and according to the UNODC World Drug Report 2021, cannabis remains the most used substance around the globe, and that an estimated 200 million people used cannabis in 2019, representing a total of 4% of the global population. The report also points out that from 1995 to 2019, cannabis has become by as much as 4 times more potent, and that as much as 40% fewer young people perceive it as harmful. Furthermore, the COVID-19 pandemic inevitably caused an increase in the trends of cannabis use globally as well. So on to the regional statistics. To quantify the scale of the issue further, let us now look at the trends in the supply of cannabis as well. So according to the EMCDDA European Drug Report 2021, more forms of cannabis are appearing these days, and new ways of consuming cannabis are also emerging. Cannabis products being adulterated with highly potent synthetic cannabinoids is also a trend that's particularly concerning. And also in the EMCDDA region 2, the drug that is the most commonly tried is cannabis, with these numbers you can see here divided in males and females. And on the national level in Turkey, around 80% of the people with drug use, they've initiated their drug use with cannabis. Further, every 3 person out of 5 who started using drugs with cannabis, they later started using other kinds of drugs as well in their later stages of life, which is strengthening the gateway drug theory. So about the gateway drug theory, as we probably all know, behaviorally and developmentally, many of the shared root causes that increase an individual's likelihood of using cannabis, they also increase the same individual's likelihood of using other drugs, such as opioids. And here to give an example, according to the US Centers for Disease Control and Prevention, or CDC in short, people with cannabis addiction are 3 times more likely to become addicted to heroin. And now quickly to wrap up this section, the need to increase efforts for drug use prevention, especially cannabis in this case, is quite evident, we can say. But I'd also like to talk about the convergence between addictive, harmful industries and talk about the EVALI disease as a striking example. EVALI disease is short for e-cigarette or vaping use associated lung injury. The disease is characterized by a sudden disruption of the normal functioning of lungs, and it was quickly declared an epidemic in the US in 2019, shortly after its emergence. So even though at first glance, this issue may maybe not seem like it is related to cannabis, further detail shows us that the psychoactive component, the main psychoactive component of cannabis, THC, as well as vitamin E acetate, to increase its effects, to strengthen it, so to say, was added to the vaping mechanism. So I wanted to give this example here, as in the US, we know that there's a growing number of decriminalization or legalization of cannabis among states. And as such, for instance, it's always changing, of course, but the last time I checked, a total of 19 states in the US have legalized the recreational use of cannabis, and Similarly, recreational cannabis is also legal in six other countries as well. Additionally, I'd like to reiterate very quickly that even products that claim to be purely made out of CBD may contain small amounts of THC. And why prevention, and especially early prevention? As youth in particular use e-cigarettes and vaping products more often too. The UNODC and WHO joint international standards on drug use prevention. It also states that prevention, first of all, it's extremely cost effective, which is obviously very important to bear in mind in policymaking. We know that for every dollar spent on prevention, at least 10 can be saved in future health, social, and crime costs. Furthermore, as we are aware that children and adolescents whose brains are still developing are particularly vulnerable to substance use, it's essential to implement early prevention strategies when it comes to cannabis too, which is also elaborated by the panelists. And to conclude quickly, I'd like to talk about some policy implications of all of these discussions and the way forward. So nowadays, we know that cannabis has become pretty much the epicenter of drug policy debates globally. But we need to bear in mind that many of these debates, they're multifactorial as they're also related to the criminal justice systems of countries. Furthermore, it's important to note that the human rights and personal freedom discourses, they at best underestimate the influence of multinational companies' influences. These industries, in particular the global alcohol and tobacco industries, effectively use these discourses that are human rights and personal freedom, etc., discourses to maximize their profit through a diversified portfolio of products.
Thank you.
And these products, I'm going to wrap up really quickly. These products, they seem appealing to the youth, diminishing risk factors among youth. Sports is an excellent tool here as it teaches relevant life skills to youth in their transition to adulthood and stressful situations. And it also facilitates youth's meaningful social interactions. And regarding specifically cannabis, my last point, the annual report questionnaire or the ARQ of UNODC, it's an essential tool of UNODC that we know it gathers drug-related data from member states. However, yes, given the relative novelty of the acceleration in cannabis liberalization, we as a civil society organization would like ARQ to include specific data on cannabis use and especially their effects on vulnerable populations in countries that legalized or decriminalized recreational use. These effects, they may be related to, as I've written also here, to child neglect or driving under the influence of cannabis, which may be fatal. Similarly, and these all constitute important topics in themselves, we think, to research and discuss further. So we're eagerly waiting for UNODC's World Drug Report 2022 this year to incorporate detailed relevant data to be shared with society. And I'm ending my presentation here. Thank you very much.
Many thanks, Zainab. As always, Turkish Green Crescent become a common player in the field of prevention and addiction of drugs, alcohol, tobacco, and even gambling. I think we don't have more time. A lot of delegates, they have another commitments with another events. And there is no questions mentioned there. But to conclude, at the start of this side event, someone told me that there were more than 50 people on. So I really want to thank all of the participants who get engaged in the side events, but also especially the speakers, the friends, and the co-organizers for being here with us, transferring their knowledge and their expertise on these issues, which is very, very complex. It is for us a pleasure to organize this kind of events, and we just wish you all the best and to be safe. Please be safe. Thank you for joining us. And please, if you could open your camera for a group photo so we can just have a screenshot. Please open your camera for a while. Thanks a lot. Thank you. Feliz, did you get the screenshots? Thanks a lot. And Be safe, please. Goodbye.